The issue of fillers in the face is controversial, and a lot of people are concerned about whether or not it's just a volume replacement or whether it does put some health or complexion issues back into the skin. And the answer to that, on the one hand, is simple. Yes, it does do those things, but on the other hand, it's complex because how does it do it? I think the term dermal fillers is actually very misleading, because most of the fillers that we use in a face are not injected into the dermis. They're injected into the other volume spaces within the face. And so you've got the element of a filler to restore a contour or to enhance a particular curve in the face, particularly around the cheek or around the jawline, which are common areas. And so the fillers can do that simply by giving that volume when it's placed correctly. There's a style of filler called hyaluronic acid, and hyaluronic acid does have the capacity to draw water to itself. And so, at least theoretically, and we do see to a large degree in practice also, that patients' skin hydration is better when they're using a hyaluronic acid type filler. Now, when it comes to where you put the filler to achieve that outcome, well, that is where you do inject very close to the surface of the skin. And it's one of the few times when we're actually injecting into the skin itself. But giving that micro volume change, which attracts the water, benefits overall by improving the hydration qualities of the skin. And that's commonly done in these days with a process called mesotherapy. And there's a way of using the filler substance, and a lot of people will have heard of the plasma injections, and you can use those as well as a mesotherapy, or you can combine those two things. Now, the key element about meso is that you're using exceptionally fine needles and you're injecting very, very superficially into the skin. So we have the issue of fillers being used for hydration and for skin texture and quality, but also as a volume enhancer or a volume replacer to try and improve curves and contours in the face.